Assalamualaikum warahmatullahi wabarakatuh. Hello guys, we are from group that discuss health in developing countries. Our group consists of Chamita Shakila Zara Chandra and Nadira Safira Zahra Setiawan. Table of content divided of 1. Introduction 2. Health system in developing country Indonesia 3. Analysis of current situation 4. Stunting nutrition problem in Indonesia 5. Tackling stunting problem in Indonesia 6. The role of health literacy in development 7. Measuring the readiness of health workers in receiving telehealth or telemedicine in developing country 8. Developing country 9. Factor and causes of health service in Indonesia are not optimal. And the last, conclusion. Assalamualaikum warahmatullahi wabarakatuh. My name Chamita Shakila Zara Chandra with number metric 276263. And I want to explain about introduction. If the development of public health can be realized, the development of a very optimal state can be carried out and achieved. The implementation of national development on the relationship between the two are very clear. The writing of this paper aims to observe, analysis, and discover solutions to overcome the development of public health in Indonesia. It is a valuable and irrecoverable asset in the implementation of national development. Improving the quality of public health in Indonesia can affect quality of life and quality of human research. In the quality of human research is good, can be used as capital to build the Indonesia nation in a higher direction. Improving health is large and effort meant in all activities of the Indonesian, with the aim of increasing awareness, willingness, and ability to live a temporary lifestyle for all, enabling you to realize the best level of fitness of your community. As a sort of founding to increase human research, economical, and social, health development is a very important element in national development. The goal of health development is to realize the ability of all people to live healthy lives in order to achieve equitable and quality health service in order to achieve optimal health. And meanwhile, the goal of medical development is to achieve the goal of strong health, creativity, and productive human being. Achieve national goals is a desire and aspiration of all Indonesian people, and it is necessary to realize and raise awareness that efforts to improve the quality of human research are part of increasingly fierce competition closely and strong in the field of globalization. In the case, the role in the success of health development is the most important asset. A healthy population is not only the success of aspect of education, health, and others program, but also involved in increasing the productivity and income of the people in Indonesia.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nadira Safira Zahra Setiawan with number metric 28167. In this occasion, I will explain about health system in developing countries in Indonesia. So, Indonesia is a developing country that has faced numerous challenges and fundamental strategic shifts. A strong national health system is required to support the implementation of health development. In the primary healthcare approach, SKN is used as reference. So, SKN is health management organized by all components of the Indonesian nation in an integrated and mutually supportive manner to ensure the achievement of the highest public health degree. So, the universe scope is divided into two components: equitable and high-quality healthcare access and risk management financing. This demonstrates that a high rate of death in disease in population, particularly in the productive age, can reduce the quality of its human research. People who have desirable fitness, both physically and mentally, can perform their sport productively, which is a good way to dedicate themselves to growing this country. So the next part that I want to talk about is analysis of current situation about health in Indonesia. So the government is required to provide 5 basic guarantees for all Indonesians. First is health, work accidents, death, pensions, and old age benefits. The individual, the employer, and the government will all contribute to the guarantee. As a result, the government will begin to implement the universal health coverage policy in terms of providing health services to the community. Where the government previously only provided health service to civil servants and ABRI or police, the social health insurance mechanism is employed. And as you can see, there is BPJS and the demand for health services. In general, demand is measured by the number of beds occupied, visits made, diagnostic tests performed, and so on. Meanwhile, patient income and preference as well as the cost of alternative goods have a positive relationship with demand for health services. Then the Indonesian people demands for health services met in three ways: self-medication at home, traditional medicine, and treatment by professional medical personnel. So the treatment with professional medical personnel is care provided by health workers in polyclinics, health centers, and hospitals. And last, the demand actually used for health services provided by professional medical personnel for the Indonesian peoples remains very low. So if you look at Table 1 demand for health services in percent, this is illustrated in Table 1, which is explained that most of Indonesian population tend to choose self-medication at home using either medical or traditional medicine. So there is stunting nutrition problems in Indonesia. Growing short is frequently regarded as a hereditary factor in Indonesia. Smoke pollution has also been linked to stunted growth. Stunting is a public health problem that must be taken seriously because more than half of Indonesian 30 provinces have prevalence rates higher than the national average. The aforementioned occurrence is worth investigating because the stunting problem has a fairly serious impact. For example, the short term is associated with morbidity and mortality in infants or toddlers. The medium term is associated with lower intellectual and cognitive abilities. The long term is associated with human resource quality and the issue of degenerative disease in adulthood. And then let's talk about tackling stunting problems in Indonesia. A local product processing innovation is one of the attempts to maintain the nutritive value of food products for varied processed food products. The nutrition counseling and training on processing corn-based products were provided in Labu Api Village, West Lombok Regency, and collaboration with partners, including housewives, particularly pregnant and lactating women, and teenage girls who live in Labu Api Village, West Lombok Regency. This activity can improve knowledge of how food influences nutrition and stunting, as well as knowledge of nutrients, benefits, and various foods and products. This activity can also help partners improve their skill in processing corn into corn milk and corn milk breaks into nuggets. And there is the role of health literacy in health development. Ineffective health information and services are frequently accompanied by poor quality health services or information dissemination and use of inappropriate media. In fact, public health is not dependent on government-provided health services, but on how to foster a culture of healthy living among neighbors. It implies the requirement to understand the level of public health literacy as defined in the health development targets, one of which is the community. The population ability to receive health information and file health complaints is limited. Cultures and beliefs are less supportive of healthy lifestyle, resulting in a low level of health knowledge. And the last is, low healthy literacy is a strong predictor of a person's health. When compared to age, income, employment status, education level, and race, given the potential ills associated with health literacy, understanding the current level of public health knowledge is critical in order to deal with various possibilities immediately. So the last part that I want to talk about is measuring the readiness of health workers and receiving telehealth or telemedicine in developing countries. Organizational readiness, technological infrastructure readiness, societal readiness, government readiness, and public or patient readiness are all dimensions that can be measured to assess readiness. The dimension used in the study were determined by the study target population as well as the various types of telehealth and telemedicine services. Fundamental in situations where a person must deal with changing mechanisms and adapt to changing conditions. According to B. Jones and Chito, judgment readiness is a dimension used to measure health workers' knowledge of the mechanism and implementation of health technology. How much benefit or difficulty health workers can feel from running telehealth and telemedicine, and health workers' desire and willingness to participate in ongoing training. So that's all from me. Thank you.
I want to explain about developing country. Developed country and developing country have a different level of readiness based on each major dimension indicator. View as a whole based and the result of refer several articles, developed country as a country that are considered better than developing country have not been better prepared, that some telehealth implementation in developing country, the extent of better prepared and developing country is due to greater need to implement telehealth or telemedicine according to the condition of some developing country who have to make effort to provide health service to more remote areas are not reached by health works. And difference with developed country is the implementation of telehealth or telemedicine is mostly to speed up the service process so that the level of importance does not force health works and institutions to implement it optimally. This topic, I want to explain about factor and causes of health service in Indonesia are not optimal. Health is an important investment to support economic development and has an important role in other population reduction, even such as poverty, because a country without a health population will not be able to uphold its own country. Health services are an important factor to increase the health standard of the population itself. There are several factors that make health service in Indonesia less well implemented. First, factor is the factor of health workers in Indonesia. Second, factor is the lack of available health facility, and health facilities such as hospital, maternity hospital, posyandu, and other facilities play an important role in improving health service because that is where the center of the health service itself is. And the last factor is the bureaucratic factor, which is quite bad in the implementation of health service in Indonesia. Actually, there are many factors that make health service in Indonesia worse. But the three factors above are the main factor causing the problem of poor service. This problem must be seriously resolved because if it continues, it will have a very negative impact on the development of the nation, such as delays in development, widening inequality in the reception of health service for the Indonesian population, increase the number of deaths, and will definitely increase the number of poverty in Indonesia. With this, the status of poverty is even worse than now. The development of proper health facility must continue to be promoted evenly throughout Indonesia, especially in remote areas, so that good health service can be accepted by all nation people, and lastly, the improvement of the system and the health sector itself, so the system runs well without these disturbances, such as corruption and action that will damage our healthcare system in the future. The community is all expected to play a role in supervising health service in Indonesia and reporting to the government if they find action they are considered to have violated the law. And the last, I want to explain about conclusion. The improvement and quality of public health in Indonesia can affect the quality of life and the quality human research. A health population not only support the success of aspect of education, health programs, and others, but also involved in increasing the productivity and income of people in Indonesia. Health is precious capital, and the implementation of national development, improving the quality of public health, has an impact on improving the quality of life of the community and also improving the quality of human research. Only good quality human research can be the capital to build the country in a more advanced direction. From all this, it is clear the optimal national development can be achieved if the development of public health can be achieved. The relationship between the two sides is very clear in the implementation of the country development. Development cannot take place properly without the availability of the fundamental capitals, public health.